Doctor, let's talk about explant. If I'm a patient and I go to you and I say, listen, I want my implants removed because I'm suffering, because I'm in pain. I've seen a lot of people on social media doing that, and that's something dangerous because social media, you know, tends to, push people to do stuff that they don't even know. And sometimes, and the mind is so powerful that you start to feeling things that are not there. How do you approach a patient who goes to you with this problem?
Laura, that's such a great question, and I appreciate the background you provided. Breast augmentation is a very popular and very common procedure. So there are millions of patients around the world with breast implants. And those breast implants can be silicone or saline. We still use both. And in some cases, there are very good reasons to later have to remove the implant, as you called it, an explant. Some of the common reasons to remove an implant can include leaking or cracking of the implant, potentially scarring around the implant, which we call capsular contracture. That scar can squeeze the soft implant, and that can cause some pain or disability, and it's a very common and good reason to take out the implant. But then there are some patients that also believe that their implant is actually causing them some kind of autoimmune disease, such as chronic fatigue or joint pain or other things along those lines. And, we have looked at this scientifically repeatedly. The question has been asked and answered over and over again. And the answer is there's not very good, strong scientific evidence that does suggest there is an association. Nevertheless, we do still have patients that insist on having their implants taken out. And often they are asking these days for the entire capsule to be removed with it, which is the scar around it.
Yes.
And if that can be done safely, we will try to accommodate the patient's request. But there are times where it's not safe to remove the entire capsule, and it may not be reasonable to remove the entire capsule. So the long story short is there are good reasons to do it, and there are some other reasons to do it where patients might be getting the wrong information from the internet or social media. And the best thing you can do is come and speak to a real board-certified plastic surgeon with the education, training, and experience in this, and talk to your plastic surgeon about whether or not it's a good idea to have your implants removed, as well as the entire capsule around your implant to be removed.